The pandemic has propelled digital transformation forward in healthcare like never before. 3 experts discuss where we are in our transformation journey and how far we have left to go.
So digital transformation is digital transformation for all stakeholders. And so certainly many of us are concerned with that patient perspective and transforming digitally to improve their access, to make their care more convenient, their care more coordinated. But it's also for the internal perspective, for the clinician perspective. And that back-end workflow or workflows have to also be digitally transformed. And there's technologies like AI or different forms of automation that can make those more efficient using digital. So you really have to look at the entire picture and all perspectives when you're trying to get at digital transformation for your organization.
It's been elusive because I think we looked at the digital technology first and not the problem that we're trying to solve. And I think that led to many misses. What we're doing now is identifying the problem first and then looking for digital technology to solve that problem. And I think we'll be a lot more successful and we'll see clear acceleration.
I'm particularly excited by what we've been able to accomplish with our investments in electronic health records, and now we've taken that investment in electronic health records and we're now able to apply cloud computing in a way that didn't really exist 5 years ago. And so we've made a previous investment to digitize the electronic health records. And now we've taken the next step forward and put that behind the power of cloud computing. And then the other dimension of the digital transformation that I think is really exciting is bringing in artificial intelligence.
I think there are tremendous opportunities to leverage digital technology for transformation. The first bucket, I would say, is communication with patients, is to enhance the digital journey for a patient through their healthcare delivery system. The second bucket would be in the management and care delivery. So the actual healthcare delivery, how do we integrate digital strategies within the care delivery? And then the third is really lowering total cost of care. And if you think of technologies such as robotic process automation with artificial intelligence, we can really leverage that technology to lower the total cost of care through decreasing our administrative burdens.
I think the greatest opportunities for transformation lie in 3 domains. One is productivity, the other is presence, and the third is quality of the interaction between the patient and the physician. Doctors are spending equal amounts of time seeing patients as they are documenting that care. In 4 or 6 hours of patient interaction a day, you're spending 4 or 6 hours documenting that. That isn't sustainable. That's what contributes to physician burnout. That's what contributes to doctors missing dinner and working in the evenings, is this tension between wanting to focus on the patient and then having to then rethink that whole visit while you're charting after the visit or later in the day.
Our approach at Geisinger to digital transformation is really to adopt the thinking of a disruptor. I think we're much farther along on our journey than we were a year ago or pre-pandemic. I think the pandemic has really accelerated digital adoption and has really demonstrated the value of digital technology in keeping in contact with our patients. At Geisinger, we used it in so many different ways. So we used remote patient monitoring to monitor our patients when they were home. We used chatbots to really handle all the administrative tasks, from scheduling appointments to vaccine questions to commonly asked questions on COVID. So when we think of the patient journey, we know that we can improve our current patient journey given the way that we've managed transitions of care, managed even down to scheduling appointments. So we have to start thinking of a disruptor experience.
I've been practicing in an electronic health record now for 20 years. And it's surprising to me how cumbersome it all is, that I have to bounce between oftentimes 2 or 3 different systems that I chart during a patient visit, then I chart at home. And I would have thought it would be much simpler. And I think that's where we're going, is moving towards a one and done at the point of care experience where it's informed with the power of access to all of the relevant information, but I'm able to do that work kind of quickly and seamlessly, kind of at the thought of speech or at the thought of writing.
To ensure the entire experience is seamless, it's really critical that organizations have a champion who is accountable for that entire experience. What we have now is a lot of really great technologies that are solving problems, but these are somewhat narrow use cases. And if we keep deploying new technologies for new use cases, they're going to solve problems and make clinician or patient lives better. But to really make sure we are building towards a seamless experience, someone needs to be responsible for overseeing how all those pieces fit together from various perspectives.
I think the best way to engage clinicians in a digital health strategy is to clearly articulate what the purpose of the digital strategy is. At Geisinger, we say we're about solving problems. So we are not using digital technology just because we can. We're using digital technology to transform the way we deliver healthcare. I think we have to be very clear about what our outcomes will be, what are our key performance indicators, how are we measuring success. And I think once the clinicians understand what the purpose of a digital strategy is, I think they will be great partners and embrace us on this journey.
In thinking about how to best engage clinicians, it goes back to the basics of understanding the different perspectives and their needs. What are the problems of the clinicians? What are the biggest problems that they are prioritizing, that they are asking for help with? And how can you select technologies and digital solutions and evaluate the different use cases under consideration to bring forward their problems so that you're meeting their needs, and with that, gain champions along the way?
We're talking about a couple of key themes: time for care, time to be home for dinner, patients over paperwork, and for that effort to be successful, we need to be engaging clinicians who are right in the middle of the day-to-day work and involving them in that transformation effort, so they really are seeing and feeling that we're marching and walking against those goals.